Hi everyone, I am Dr. Ramya Kabin. Welcome to my channel Dr. Domtics. In my previous lecture video, I have talked about maxillary major connector. The one who is watching my video for the first time, they will get link for previous video at the end of this video. Don't forget to follow, subscribe, like and share. Now let us begin the session. Mandible major connector. Major connector is the connector which connect component on one side to the another side. It is same like a bridge which connects the two road. Now, moving to the next. Introduction. In general, mandible major connectors are long and relatively narrow. It is long and relatively narrow as compared to the maxillary major connector. If you want to know the from beginning what is the major connector, then you should watch my previous lecture video because it is connected to it. You will not understand if you watch this video first before that. So don't forget to watch that and understand. It is for better understanding. Okay. Concept of mandible major connector is little bit critical as compared to the maxillary major connector. Maxillary major connector तो बहुत easy है design करने के लिए, but mandible major connector is little bit difficult, but it's easy if you understand. Because why it is difficult? Because it has many vital structures surrounding to it, like tongue, floor of the mouth, and you have vestibule. Floor of the mouth contain many vital structures like blood vessels, salivary glands, everything. So hence it is difficult to design. Now, what should be the ideal properties? It should be rigid. If it is flexible, then it will damage on its movement. Whenever there is a function, application of the function, or whenever there is application of the force, if it's flexible, it is uncontrolled. It have many unwanted forces distributing on abutment and soft tissue. Hence, it should be rigid. Rigid. अभी bridge भी rigid रहेगा तो ही then you can pass on that ना. So it should be rigid. Now it should protect the associated soft structure. Like we are placing something inside the mouth. Mouth is the one which is already so much complex. In that you are adding, or in that you are putting one more thing, then it should be in harmony with the other structures. It should not damage. Hence, it is like protect. You should protect the associated structures. Now, if you are giving the maxillary connector tooth supported. Tooth supported means you are giving connecting one teeth is missing between the two teeth. Then you are connecting and giving a RPD. If it is like that, then relief is not required. If you are giving it distal extension, that is no posterior teeth are present. You are taking a support from a premolar. Then in that you will only have a tissue and tooth support. Both support you are taking. During that time, you will require the relief. If you want to know this tooth supported and tooth tissue supported, you should watch my first video. I will also put that link at the end of this session so that you will understand the introduction. Now bead lines. Bead line is something I told in a maxillary major connector. It is a fold. It is the fold in the design which is required for the retention in maxillary connector, because there you have a broad palate. In there you taking retention from the palate. So bead line is one of the unique characteristics of maxillary major connector. We don't need that in mandibular major connector because we don't have a palate. So we not required that design concept. Next, I will explain you the concept, like why distal extension of a mandible major connector is so difficult as compared to the maxillary. Whenever there is application of a force, imagine like you have a RPD in your mouth where you have missing both the posteriors, that is both side molar are missing, and you are wearing the RPD, class partial denture. So whenever you apply force, you feel rotation of the prosthesis inside your mouth. Whenever there is application of force, there will be a rotation. Why? Because the tissue will get compressed and RPD will move downwards, and the abutment teeth supported by the direct retainer will lift up. So you will feel the rotation. So to avoid this, we are giving the relief. Now, one more important thing you should remember while designing for the mandibular major connector is that you should measure the depth of the floor of the mouth. You can use a periodontal probe to measure the depth. In first figure, you can see there is a maximum depth, say about 8 mm is available. Here you can use any kind of mandible major connector, but in image B, you see that there is greatest amount of the slope of the floor of the mucus towards the tongue. So it will give you less room for the mandible major connector. So in this you have to give a maximum relief for the proper functioning of the floor of the mouth. And you have to use the lingual plate only, because it is ideal to use lingual plate instead of a lingual bar or any other connectors. Now moving to the next, that is types of mandibular connector. It is so much easy to remember. Which are those? That is lingual bar, lingual plate, double lingual bar, labial bar. So double lingual bar is also called as a Kennedy's bar. I will tell you why it is called as Kennedy's bar, but you have to watch this video till end to know why it is called as Kennedy's bar. Now moving to the lingual bar. Lingual bar is most frequently used whenever you are planning for the cast partial denture. First thing they check for connector is the lingual bar. So it is also have a criteria. You can't use the lingual bar everywhere. So you have to think where you should use. So it is indicated for all tooth supported. If there is one teeth missing and anterior and posterior teeth are present, then you can go for the lingual bar. So it is half pear shaped in a cross section. In this you can see it is half pear shaped. This larger portion come at the bottom, that is towards the floor of the mouth. So its thickness is about 4 to 5 mm. Whether to decide lingual bar has to be your major connector, you should know the space, how much space is available. It should have 8 mm of space minimum. If it is less than 8 mm space, don't go for the lingual bar, because it required minimum thickness of the connector should have minimum thickness of 5 mm and minimum of 3 mm distance between free gingival margin and superior border of the connector. So 3 plus 5, 8 mm. So 8 mm is compulsory for this. You can't reduce 5 mm, it will not be rigid. So this is mandatory. How to measure? Whenever patient will come for the OPD, during examination, when it confirmed that patient need cast partial denture, first you should go with the diagnostic cast, then you should go for bite registration, then next coming to the depth measurement using periodontal probe. You can use periodontal probe for the depth measurement. Ask the patient to protrude their tongue and touch the vermilion border of the upper lip. When patient does this, then floor of the mouth, the muscles in floor of the mouth will get activated, or they come in their function form. This time, gently place the periodontal probe, make the tip touch the floor of the mouth and measure the most apical position of the gingiva. This is the most apical position of the free marginal gingiva. You should measure like this for all the teeth and decide how much space is there. Depending upon that, you can give the major connector. Now this is the lingual bar. You can see, it is placed and we have a two rest and one indirect retention. Now what are its advantages? It is really simple design. जल्दी से हो जाता है, simple है, कुछ complicated नहीं है, एक बार बना देना है बस. And it have a minimum contact with remaining hard and soft tissue. Okay, so because of that, there will be less plaque accumulation and it will have increased soft tissue stimulation. What are disadvantage? Disadvantage when it starts. When you do improper waxing procedure or you do aggressive finishing, it will reduce the thickness of the bar and it will reduce the rigidity, which increases its flexibility, potential damage to the remaining teeth and soft tissue. If you are reducing its thickness, then it is not fulfilling the primary property of mandible major connector. Now coming to the lingual plate. Lingual plate is also half pear shaped lingual plate, but it has the metal extension like this till the cingulum of the remaining anterior teeth. It is carried onto the lingual surface of teeth above the cingulum and presents a scalloped appearance so that it will get flushed with the tooth surface. There will be no any separation, or it is won't be any separate part. It will get flushed with tooth surface, so it will provide self-cleansing properties. Now this is the lingual plate. It is extending from the lingual surface of remaining anterior teeth till the as low as possible in the floor of the mouth. as low allowed by the soft tissue. You can see. Now the lingual plate must be supported by the rest. Here you can see they should be on a mesial fossa of the first molar. They shouldn't be far from the or more posterior to this. Failure to provide these rest may result in rotation of the framework and labial displacement of the anterior teeth.
In this picture, you can appreciate a scalloped appearance of the major connector. This scalloped appearance have a knife edge at interproximal area. It is extending till contact area of the tooth. This knife edge kind of design is very important to include in a major connector because it will get flushed with the tooth surface and there won't be any elevation of the metal surface and following possible discomfort to the teeth. Another important thing to remember in this design is that to increase the rigidity of this major connector, you should give a thick inferior border and thin superior border. Hence, it will increase rigidity of the major connector.
So whenever there is a spacing between the lower teeth, anterior teeth, or whenever there is the open embrasure present, then you can use the step back design. What is the step back design? Here I'm going to explain you. So step back means the design. In this here you can see it should extend till the contact area in interproximal, then follow the line angle of the teeth and cross the free marginal gingiva at right angle, then take gentle curve and follow the line angle of adjacent teeth. The same will follow on all other teeth. This will avoid the display of the metal labially because they are open embrasure. So step back is the modification of the lingual plate for the open embrasures. So remember one point, whenever in planning for the step back, the superior border will get thin, hence reducing the rigidity. So to maintain the rigidity, lower surface should be thick. And in this design, I told you it will cover the cingulum of the anterior teeth, but it can be left open in a posterior teeth like this. It is one of the kind of the design you can use like this. We will cover anterior teeth lingually, but you can leave this uncovered in a posterior teeth for the maintenance of oral hygiene. Now, what are the advantages of the lingual plate? It is rigid. Yes, it is rigid because it is covering large area. So it is used for the stabilization of remaining anterior teeth. As we all know, anterior teeth won't give that much support or they are not fit for as abutment. Hence, they are splinted together using this lingual plate and together it is supporting for the prosthesis. So whenever you are planning for the extraction of lower teeth afterwards, because due to some systematic history of the patient, then that time you can use the lingual plate, extract the teeth consequently, and replace the teeth using a prosthetic teeth. You can place the prosthetic teeth using a cochlear on a lingual plate. For time being, after extraction of all the teeth, you can go for next definitive treatment. Then it will act as indirect retention because it is away from or it is perpendicular to the fulcrum line. Fulcrum line, it is the imaginary line connecting most posterior abutment around which prosthesis tends to rotate. So about indirect retention also I have told in my second class. You can go and see. Now it whenever you have planned the lingual plate nicely or you have designed the lingual plate nicely, then it is most comfortable to the patient. What are these disadvantages? It can lead to the decalcification of enamel surface because it is covering the whole lingual surface. It is going under the function daily. It is scraping the lingual surfaces. It is damaging to the enamel surface and it lead to the irritation of the soft tissue because it is covering more area. And extreme care should be taken because oral maintenance of oral hygiene is so much difficult when you're using the lingual plate. Then it has act as the trap for the food debris. Now coming to the double lingual bar. Double lingual bar, why double lingual bar? Because it's having a two kinds of bar in it. So hence it is called as double lingual bar. So here it describes the characteristics of both the lingual bar and the lingual plate. See here also it is same as the lingual plate. It is also covering the cingulum of the anterior teeth and the lower one as low as possible in the floor of the mouth. Hence it is acting as the lingual plate, but it is not lingual plate because it is not completely filling. That is metal sheet is missing. Here you can see the space. Because of this space, there will be self-cleansing action, that is upper border will replicate lingual plate characteristics. Lower border will replicate lingual bar characteristics. Upper bar on the cross section will give you half oval shape. It should be 2 to 3 mm in a thickness, in a height, and 1 mm in a thickness. Lower bar is like a lingual bar. It is half pear shaped, same as the lingual bar, 4 to 5 mm thickness. Now, what are the advantages and disadvantages of the double lingual bar? It acts as indirect retention and it used for the horizontal stabilization. It allows the free flow of saliva because it having space in between. And what are the disadvantages? It is also act as trap for the food debris and it will be irritating to the tongue because of complex design. Now coming to the labial bar major connector. Labial bar is rarely used because it is most complex design to accomplish and also it is discomfort to the patient. The labial bar run across the mucus on a facial surface of mandibular arch. It is running on an external curvature, hence it is long or be longer as compared to other mandible major connectors. Where all you can use this labial major connector is whenever there is malposition or lingually inclined teeth, large mandibular tori that pre-occlude the use of lingual bar or a lingual plate. In this condition, you have to use labial bar. Try to avoid the labial bar because success with the labial bar is really less. So whenever possible, try not to use the labial bar. Try to convert the case which will accept other connectors, not labial connectors. And we have a one modification also in a labial connect, that is swing lock removable partial denture. It is useful to avoid the pressure on anterior teeth. It has the hinge axis on one side and locking screw on another side. Whenever during the insertion of the denture, the locking screw is open. And whenever it is inserted or whenever it is come under the function, the locking screw will get locked. It is like a gate. It is open and it is closed during the function. So whenever the process is not under function, there won't be any unwanted pressure on a abutment teeth. That is useful during those cases. Now, what are the advantages of labial bar? Mandible teeth are tipped so far lingually that time you can use this. But disadvantage, patient acceptance is really poor. Bulk of connector distort the lower lip and it is discomfort to the free gingival margin and vestibule because you won't find vestibule depth more as compared to the depth in floor of the mouth. Hence, it will be problematic for the placement of the major connector and its rigidity. So it will be discomfort. If you try to increase its rigidity by increasing its thickness, it will scrape the free gingival margin and it will also harm the vestibule. Now, all points to remember, I will tell you what all connectors are used in what all conditions. So whenever there is a tooth supported RPD, that is there is no posterior teeth missing, that you will have a posterior teeth as well as anterior teeth and the middle one is missing, that time you can use the lingual bar. So whenever there is lingual bar must have a 8 mm thickness, sorry 8 mm space between the pharyngeal margin and floor of the mouth. If there is the less distance between the pharyngeal margin and floor of the mouth, and whenever there is a large inoperable tori and there is a high lingual frenum attachment, lingual plate is the best for all things. General, this lingual plate is like general. You can go for lingual plate most of the time, but lingual bargi is more good because it is not covering much of the soft tissue. And whenever the abutment with reduced periodontal support, you can go for the lingual plate. And the reduced periodontal support plus open embrasures, then go for the step back lingual plate, or you can go for the double lingual bar. Replacing all posterior teeth, if there is a class 1, Kennedy's class 1, then you can go for the lingual plate. I have talked about introduction and classification of the removable partial denture is my first lecture video. I will give you a link at the end of this session. Okay. If you're having any doubts, then let me know. Thank you for watching my lecture video. Don't forget to subscribe and follow for my new videos. I told you that why double lingual bar is also called as Kennedy's bar. I told you that I will tell you in the end of the session. Okay, why it is called as Kennedy's bar? Because Edward Kennedy, who have given the classification of removable patch denture, have popularized this double lingual bar. He told that it can be used in class 1 and 2, that is distal extension, RPDs. It is the best indirect retainer. Hence, he has popularized it and told about its correct application. Hence, it is given name after him, that is Kennedy's bar. Hope you find useful. Thank you so much once again.